What is an MRI? An MRI is an acronym for magnetic resonance imaging, which also used to be called nuclear magnetic resonance imaging, and it is a scanning technique used in hospitals to create highly detailed photos of body regions that cannot be produced by the scanning means such as X-rays or CT scans. In this image, by the orthopedic and laser spine surgery, we see X-rays compared to MRIs and CT scans. For the X-rays, you can see the X-ray takes a picture of just the bone. It doesn't get any tissue. The CT scan takes a fairly detailed image, but the MRI takes a far more detailed image. The MRI machine is essentially a giant circular magnet with a rolling bed in the middle, and it uses radio waves in a computer to produce highly detailed pictures. So how does an MRI machine actually work? The human body is roughly 70% water, and water molecules are made up of two hydrogen atoms and one oxygen atom. In a normal state, the spins of the hydrogen nuclei are random. The circular magnet creates a significant magnetic field which causes the spins of these hydrogen nuclei to align. Then the machine releases a stream of radio waves, which creates an alternating magnetic field, and the protons absorb the energy from these waves, and it alters their spins. When the magnetic field is eventually turned off, the protons will slowly return to the normal spins, and this process is known as precession. The MRI machine also contains receivers, and when the protons return to the normal states, they release radio signals that the receivers detect. The computer then stitches together an image with the data it gets from the receivers. The MRI can detect different body regions because the protons in different regions return to the normal states at different speeds. Some patients may be given an injectable liquid dye to identify specific problems, and the dye will add contrast to the images, making the problems easier to identify. So are there any risks or side effects to having an MRI? MRIs are painless and are an excellent alternative to X-rays, which expose the body to harmful ionizing radiation. There are no known harmful side effects, and they produce highly detailed images of the human body part imaged. Since the MRI machine uses very strong magnets, which are approximately 1,000 times stronger than a fridge magnet, if you have any metal implants, such as artificial heart valves, artificial joints, pacemakers, rods, metallic chips, or surgical clips, it is crucial that you tell your physician or the MRI operator. They should be aware of this beforehand, but it's always good to be on the safe side. Since you will be laying inside a tube that isn't very wide or very tall, it can get claustrophobic. If you struggle with claustrophobia, inform the doctor or the operating staff, and a sedative may be issued. So what is it like to have an MRI, and how do I prepare? Prior to the MRI, you will arrive at the hospital and you will be asked to change into hospital gowns. Then you will possibly be asked to complete a questionnaire, and you will have to remove any metallic objects on the exterior of your body. Once brought into the scanning room, you will be laid down on a rolling bed, and the bed will then be rolled back into the machine. It tends to be cold in the scanning room, so you can ask for a general or heated blanket. If you are getting a head MRI, a tight-fitting cage or mask may be placed over your face, and these are known as coils. These coils act as the receivers I discussed earlier. They detect the radio waves emitted by the protons and feed the information to the computer so an image can be generated. These coils exist for almost every body part, but the head ones are by far the most noticeable. You are often provided a pillow and you must lay completely still. Some centers will provide you headphones or earmuffs to dull out the sound, as the machine is extremely loud. The test can take longer if you move, as movements will blur the images, so most people resort to sleeping.